Hello, my name is Kokap Sena, and I am a graduating student at UIT, and this is my research presentation on testing BMI, body mass index, and waist circumference in seniors. And this is what you can expect from this presentation. I'll be presenting my research question. I'll be giving a background. I'll state the method, the variables, and ethical considerations. I'll go through the stats. And a few potential challenges. All right, so here's my research question, and I'll read it as it is. To achieve a healthier body mass index of anywhere between 18.5 to 24.9 and waist circumference in obese or overweight seniors above the age of 70 residing in Oshawa retirement homes, is a high-intensity sport like advanced aquafit swimming or a low-intensity sport like aquafit swimming better? I will now give a little overview of the background. Alright, so according to the Canadian guidelines for body weight classification in adults, the normal BMI for seniors ages 65 plus, it ranges from 18.5 to 24.9. And the waist circumference for women above 88 centimeters, also 35 inches, it's considered not healthy. And the waist circumference for men above 102 centimeters or 40 inches is also considered not healthy. So if you do, if your waist circumference if you're a man and your waist circumference is above 102 and for women above 88, or if your BMI is not within 18.5 to 24.9 and it is more than 24.9, then you are at risk of developing health problems like diabetes, health disease, high blood pressure, obesity, and also impairments of activities of daily living, which are known as ADL. Seniors with a waist circumference that is above the norm and the BMI that is above the norm, they are also at risk of developing these diseases. And so ADLs, there's a picture of, shown on the right. ADLs are day-to-day activities that you would perform. So like bathing, dressing, eating, walking around, transferring from one place to another, chair to the bed, going to the washroom, toileting. So these are known as ADLs. As I mentioned earlier, obesity, it is an illness that you can develop from having a really high BMI score, and if your waist circumference is above the recommended amount. So it's a great burden of chronic illness globally. So it's not only here in Canada. Obesity is an issue worldwide. So if your physical activity is reduced, if you're not as physically active, you are prone to developing obesity. There hasn't been globally, there hasn't been any improvements towards the prevention and management of obesity, and 2/3 of the elderly population aged 65 to 75 have a BMI that's above 25, and that is a problem, and this is what we need to focus on. So according to the National Population Health Survey on seniors' physical activity in Canada, seniors that were sufficiently active, there were 14%, moderately active 21%, and inactive 65%. So that number is really, really high, and us public health officials, we really need to focus on how to bring that number down. and how to bring the other two up. Seniors can benefit they can really benefit from this study, and us public health officials as well. We can benefit by understanding the importance of functional activities on health, and on the other hand, health officials, they have the advantage of being able to teach the senior demographic how to prevent themselves from leading towards these health failures. As I said before as well, there's obesity is increasing, and no country has actually reported population-wide success regarding the prevention and management. And this study really focuses on trying to go somewhere with reporting success, that we are doing something, and there will be change. All right, so why is my study important? Why hasn't this been done before? What hasn't been done before? That is now what I'm going to be going through, so the knowledge gap. So what's new? The previous studies have really focused on diet or a specific physical activity. However, I've not come across a study focusing on the senior demographic in Canada on the achievement of a healthier BMI and waist circumference by comparing high intensity and low intensity workouts. So like aquafit swimming at different intensity levels. We will now go through the methods of this research study. So we'll cover the study design, the subjects themselves, and the incentive given to them. All right, so the study design of this research will be it will be constructed as a randomized controlled trial, so an RCT, and it will run over a span of 6 months, in which the BMI and the waist circumference of all the participants, it will be recorded every 2 months. And for the safety of the participants, we will have a licensed physician that will be present at during all the scheduled classes in case of an injury. And all the participants, they will be mandated to sign a formal consent before participating in the study. And simple random sample from which all the participants will be randomly assigned to either low intensity aquafit swimming class, or they'll be assigned to high intensity, and we will use simple form of like a hat, and they will just draw out whichever class they will attend. The data that will be collected, it will be continuous. So for example, the BMI rates, they will range anywhere from between 18.5 to 40, and they both will be compared between both of the intensity groups. Our subjects will be so seniors, first of all, and they will be divided into two groups of either low intensity aquafit swimming and high intensity aquafit swimming, and it will include 10 males and 10 females. So we're gonna divide them up equally and randomly. So there'll be 5 males and 5 females in each class. And as mentioned earlier, the study will run over the course of 6 months. And upon the approval of the contacted seniors, participants will be recruited, and they will be given an eligibility questionnaire, and then they will be randomly assigned to their groups. So, when recruiting our subjects, we will need to consider a few inclusion and exclusion criteria. Firstly, inclusion. We are looking for seniors above the age of 70 in retirement homes in Oshawa, and then seniors who are classified as overweight or obese according to Health Canada. So, anyone who's overweight, their BMI ranges from 25 to 29, and an obese person is 30 plus. So, we are looking for them. And then, if their waist circumference for women is above 88 centimeters, and for men above 102 centimeters, these people are eligible to participate in this study. A few criteria that we will need to consider to exclude from the study would be seniors who have actively and who have been actively involved in another physical activity or aquafit swimming over the past 6 months. Anyone with a special diet will be excluded from the study. Seniors that have a serious illness that's life-threatening will also not be considered for the study, and seniors with healthy BMI, or if their BMI is underweight, they will also not be considered. And because one of the requirements for the study is to know how to swim, obviously that is what our study lies around. So the seniors who do not know how to swim will also be excluded from the study. To minimize loss of follow-up and to appreciate the participants, we will be giving an incentive to all the participants. We will be partnering up with Ivanhoe Cambridge, and all participants will receive a $25 Oshawa Center gift card. We will now go through the variables. So the hypothesis of the research, predictor, main outcome, and the intervention. So the way the study is constructed, it does require 2 alternative hypotheses and 1 null. So the null hypothesis would be that if the study was conducted, both the low intensity and high intensity aquafit swimming classes, they will show no change in the BMI and waist circumference. And then for the alternative hypotheses, one scenario would be like if the aquafit swimming classes will result in healthy BMI and waist circumference. So that is the low intensity classes. And the second option would be if the advanced aquafit swimming classes, so the high intensity classes, if they will result in a healthy BMI and waist circumference. So the variables we need to consider in this study would be the predictor, the main outcome and intervention. So firstly, the predictor, the aquafit swimming classes that are taught at 2 different intensity levels, they themselves will be the predictors as they will indicate which one of the classes or both will help the participants achieve a healthy BMI and waist circumference. And the main outcome and the aim of the study itself is to be able to give the seniors a chance to achieve a healthy BMI rate and a waist circumference. So once again, a healthy BMI rate, we want it to fall in between 18.5 to 24.9, and the waist circumference for men, we want it to be less than 102 centimeters, and for women, we want it to be less than 88 centimeters. And the intervention of the study will be the intensity of the aquafit regime, and it will be measured by heart rate. So we will be collaborating. We aim to collaborate with the brand Fitbit, and all participants will be given waterproof Fitbits for the duration of the study to keep their heart rate consistent during all their workouts. Here are the ethical issues that will be considered in this research. The UIT Ethics Board will be asked to approve the study prior to conducting it. The study will only proceed with the formal consent of the participants, the aquafit swimming instructors for both of the classes, the retirement home, the licensed physician, and the Fitbit providers. All of them will be asked to sign a formal consent. The participants will be trusted to keep a close eye on their heart rate as part of their consent form. However, they will be reminded by their aquafit instructor at all times. We'll now be going through the statistics, the potential statistics of the study. The data that we will receive from the study will aim to create inferential statistics that will be generalized to a larger group of population so that all seniors that are classified as overweight and obese, they will all be able to relate to the study. And the study initially aims to help seniors to take initiative to live an active lifestyle to prevent themselves in putting themselves at risk to health problems. A t-test will be performed through a statistical analysis to compare both of the interventions, and standard deviation will be calculated of both of the groups distinctly to analyze a comparison between the participants of the same intervention. And apart from dividing the participants based on the intervention, the groups will also be divided by sex to analyze the differences in that as well. I will now go through a few potential challenges that we could overcome when conducting this research study. So it can be challenging to recruit a sample from a population with such specific criterias, so that, as I mentioned earlier, the inclusion criterias. So if the sample is not found within Oshawa, we will widen the study's limited location and possibly recruit from retirement homes outside of Oshawa or potentially the Durham region. One of the study's criterion is to have not participated in any physical activity prior to over the past 6 months. So it is difficult to track something like this down, like such information. However, all the participants, they will be considered for the study using the intention to treat analyses. And lastly, here are my references, and thank you so much for watching my research presentation.